Hello, everyone.
Hello.
So, some people can hear. Good.
I can hear too.
That's always a good thing. So, Theresa, do you want me to share from my desktop, or are you going to share from yours?
Can you share from yours? I'm still trying to figure out how to get the camera to work.
I'm trying not to get the camera to work. You know, I want to be this person with a voice and no face, and because I like that picture it shows of me.
Oh, you want to hide today?
I'm Keisha McDonald. I am the monitor for the room, so I'll be
Hey.
attendance today. And recording.
So, can you see my desktop?
I can see it.
Good. Hey, we've made progress.
How do I show my picture?
It's loaded into my profile, so it's probably pulling from my Zoom profile.
Oh, okay, I got you.
All right, and I have a name that just says iPad. Can you type your name in the chat? Thank you. Theresa, have you clicked on the video?
Yes.
There you go.
There it is.
I can show me too. I'd rather the other picture.
Okay.
So, should we get started?
Yeah, let's get started.
All right.
Okay, and just one other thing. Anybody that is not presenting, can you mute your microphone, please?
That does help. So, introduce ourselves. Theresa, you can go first. You're listed first.
Okay, hi, I'm Theresa, and I'm a clinical mental health student at Southern New Hampshire University. And I just want to say hi and welcome everyone.
And I'm Franc Hudspeth. I'm one of the associate deans over the counseling program at Southern New Hampshire University. I'm live from Mississippi. Glad to have everyone here, and we hope that this is useful. for those who are participating. So I guess we can move.
Okay, you're in control.
All right, first slide.
So we just want to welcome everyone, and today this session is going to explore play therapy as an intervention for dementia clients. The workshop focuses on the principles of play therapy and how they can be utilized. The session will also explore Sandtray and doll therapy as a creative approach to treatment. So the goals today that we want to focus on is to understand dementia stages, and the psychological symptoms. We want to explore Sandtray and doll therapy as interventions for the management of dementia symptoms. So first we want to talk a little bit about what dementia is not, because sometimes there is a little bit of misunderstanding about what dementia is. So first we want to discuss what it is not. It's not normal, and it is not a normal process of aging, and dementia is not a specific disease. So what is dementia? Dementia is a syndrome, and so the syndrome pretty much, or a group of symptoms, and dementia is progressive. And dementia, some of the symptoms is problems with the client's memory, their reasoning and judgment, their communication and language skills, their visual perception, and their ability to focus and pay attention, which means they may wander a little bit, they may get in a car and forget where they're going. Reasoning and judgment would be things like entering into a situation that's dangerous. And memory could be anything from remembering their loved ones or certain situations.
And I can say that if you're talking about early onset dementia, that can occur. It's a much smaller percentage of the population. Early in the diagnostic process, the lack of ability to focus and pay attention may look a lot like adult ADHD, and there's this decision tree to have to go through of is this just adult ADHD finally showing up, or is this actually dementia and something that is more progressive? And so oftentimes the need there is for a much more extensive cognitive battery, which may or may not happen, because most of the times, or often, these initial assessments and diagnoses are done in kind of a primary care setting, and the ability of the primary care physician or whomever is doing it may not have access to the cognitive batteries that are necessary to really fine-tune the diagnosis to say, yes, this is dementia versus something else.
So the differences between dementia and Alzheimer's. So dementia is a brain-related disorder, and it's caused by diseases. And one of the leading causes of dementia is Alzheimer's. Some other causes are stroke, brain tumors, reactions to certain medications, vitamin deficiencies, and there is no known cause for Alzheimer's. The duration for dementia is permanent, and it comes in stages. In Alzheimer's, the duration is about 8 to 20 years. The age of onset for dementia is 65 years and older, and that's if it's caused by Alzheimer's. If it's caused by one of the other causes, the age can differ. Alzheimer's can occur as early as 30, though. Symptoms of dementia is focus, attention, memory, reasoning, judgment, comprehension, and attention. And Alzheimer's is difficulty remembering new information, mood, and behavioral changes. I
can say that I've been a pharmacist for 30 years, and 30 years ago, Alzheimer's was kind of a new thing, and trying to come up with an idea of what this was and what differentiates it between just age-related cognitive changes and dementia. And yes, brain research has taken us a long way since the late 80s, early 90s, but there's still kind of this battle of what's causing all of this. If you look at some of the different research behind Alzheimer's, there's multiple factors involved. And I know when I was first becoming a pharmacist, long before I ever became a counselor, one of the first things that was thought about Alzheimer's was that it was actually related to a higher level of aluminum in your blood system and then in your brain. And they thought that aluminum deposits in your brain was causing Alzheimer's. And so there was this big push and scare for everyone to move away from drinking things out of aluminum cans. And so that we've come a long way from there. We know there's much more involved in it than just aluminum deposits. And probably that wasn't the best explanation for things anyway, because why would this all of a sudden be showing up now when people have been drinking things out of aluminum-based cans and things like that for a very long time? So we have made progress. There are newer medications on the market that help with the cognitive decline around Alzheimer's, but still, there's 5 or 6 different things that play in Alzheimer's alone. So think about how brain research is trying to separate out just age-related cognitive decline from dementia to Alzheimer's.
Different kinds of dementia. Dementia is not one thing. There are several routes to the symptoms that we discussed earlier. We have Alzheimer's, vascular dementia. We'll talk about Alzheimer's first, which causes problems with memory, language, and reasoning. About 5% of cases start before age of 65. Vascular dementia is about 17%. It's impaired judgment, difficulty with motor skills and balance, heart disease, strokes, and increases its likelihood. Mixed dementia, 10%. Several types of dementia contribute to symptoms, most common in people over the age of 85. Let's see. And then we have frontotemporal dementia, about 2%. Personality changes, language problems, most common onset between the ages of 45 and 60, Dementia and Lewy bodies, 4% caused by Lewy body proteins. Symptoms can include hallucinations and disordered sleep. And then there's another about 3% conditions such as Creutzfeldt-Jacobs disease, depression, and multiple sclerosis. You want to add anything to that?
Yeah, the Lewy body dementia. I have a family member that was in the last year diagnosed with Lewy body dementia. And what's really interesting about it compared to Alzheimer's and other types of dementia is its early symptoms look like Parkinson's disease, and there's this overlap. And so more or less the treatment early on might be for Parkinson's disease, which at the same time, the treatment for Parkinson's disease exacerbates and makes the Lewy body dementia worse. And so they have this problem of differentiating what is what. And what finally helps the diagnostic or rule out process is Lewy body is very fast progressing. It's not a slow process. And the fact that Lewy body dementia comes along with a lot of hallucinations starts to help set it apart from other things. It's different from hallucinations and delusions that come along with schizophrenia. Most of the times the hallucinations are somewhat benign and not quite so scary as it would come along with schizophrenia, but that finally becomes one of the things that allows it to be differentiated from Alzheimer's, Parkinson's disease, and other types of dementia. In Parkinson's disease, the hallucinations that come along are more related to the medication that people are taking from Parkinson's. So if you withdraw the medication, the hallucinations go away. With Lewy bodies dementia, the hallucinations are there. They're not going away as a result of changing something. They are there as part of the disease progression.
Okay.
So brain changes. One of the things that I like about this slide is, it looks very complex, and it kind of compares Alzheimer's from frontal to Parkinson's, Pick's disease, Lewy body dementia, vascular dementia. And one of the things that it does here is it shows you the connections between all the different symptoms that may have come along with it. With this diagram in the middle of this outline of a human head is a good representation of how complex this is and how difficult it is oftentimes to tease out which specific dementia-related event is occurring. You'll see all the different colored lines that are overcrossing and may be common amongst dementias. And like I said, that just makes it even more complex. Sometimes it is more of the severe symptoms, like with hallucinations and Lewy bodies, or fast progressing Alzheimer's, things like that help separate one from the other just because of how the disease progression is occurring. So you can see all the different symptoms on the right there that could occur in any of these at any time. It's just oftentimes it's about when it occurs within the progression of the disease.
So now we're going to get into some of the interventions, and I guess we wanted you to know that this slide means that even though dementia clients, sometimes they may not be able to verbalize, they still have plenty to say. So some of the interventions that we're going to discuss is play therapy in general, DAR therapy, and Sandtray. Definitions of play therapy. Play therapy is the systematic use of a theoretical model to establish an interpersonal process within trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychological difficulties and achieve optimal growth and development.
And I can add to that in that we often think of play therapy as something for children, whereas some of the early use of play therapy was actually more with adults. And I know when the Association for Play Therapy was working on this definition, it took about 10 years to come up with this definition, because play therapy is useful across a lifespan. And so they wanted to leave client age out of it. And basically, so you see here, as you see, help clients. It doesn't say help children. It doesn't say help adolescents, adults. They wanted the definition to have more of a lifespan approach to it, because it is very applicable in different stages in life. I can continue with the play therapy part.
Okay.
Because I know it well. One of the reasons why I know play therapy really well, I've been a play therapist for, let's see, I took my first play therapy class in June of 2001, so about 18 years now. Registered play therapist, registered play therapist supervisor, and happened to be the editor of the International Journal of Play Therapy. So play therapy has been a big piece of my life and practice for a very long time. One of the things that attracted me to play therapy was that it did not require, specifically what I do, child-centered play therapy, it did not require verbal communication from the client, regardless of age. It more or less works from the perspective of working on what's going on in the room. It works on kind of the unconscious, subconscious level. And since it does not require the ability to communicate, that's one of the things that makes it so applicable to dementia patients. Oftentimes, language or being able to generate words becomes difficult. And so if you were relying on something that required them to communicate specific things in words, it would become difficult for that to be useful. Play therapy itself, most of the words are coming out of the mouth of the play therapist. They're not coming out of the mouth of the client. The play therapist there is using specific skills to facilitate what's going on in the room. And we might talk about those in a minute. We know that play therapy is pleasurable. We know that play has a purpose. Play is not random. Play is typically a good way to work out things. It's a good way to practice things. So it has, the psychological benefit, the educational benefit. Within child-centered play therapy, one of the things that you do is when you bring the client in the room, and it doesn't really matter which age they are, you typically say to them, this is a place you get to decide what you want to do. You can do whatever you want to do as long as I don't get hurt, you don't get hurt, and the toys in the rooms don't get destroyed. So you're giving them a lot of freedom of choice. And so when the client then begins to do something, it is by their own direction, their own choice. They're not being coached in any way to do a specific thing. Now that is with non-directed play therapy. Directed play therapy would be different. As I said, it evokes some of the unconscious feelings and thoughts, some of the buried things, some of the things that might be in a dementia patient that might be actually hidden by the dementia itself. It evokes fantasies and plays. When we talk about doll play, one of the things about it and part of play therapy is it helps unlock the part of the brain that remembers those things from the past. Somewhat kind of a reminiscence type theory, in that a similar thing or a common thing that they've done in the past helps unlock something that's locked by the dementia. There's very familiar procedures and skills that we use in play therapy. Some of the skills that we use in play therapy are very much related to the micro skills that we learn in a counseling program, like reflections of feelings and content. This whole idea of non-judgmental stance, congruence, empathy. Some of the other skills and conditions of play therapy that might be used is we use attending behaviors that we would use with any client. We use them in play therapy, and we would call it tracking. And micro skills, we talk about the minimal encouragers and being present in the room, and we talk about attending to the things that the individuals are doing through our minimal encouragers or reflections or paraphrases. Within play therapy, we're often doing this through what we call tracking. And so tracking is a way to say, I'm paying attention to you, but at the same time, it's not predisposing the client to do something specific. We track in a very generic fashion, and only are specific words and terms used once the client actually names something. So, a child's playing in the room, we're going to say, you're playing with that. Or the child's moving something around, we're going to say, you're moving that around. That part stays that way until the individual names it, and then it's free for us to use that word. So by using that kind of non-specific terminology, we don't predispose the client, whether it be a child, adolescent, or adult, to do one specific thing. And then the playroom itself is a safe place. They learn through the modeling of the play therapist that there's safety, that there's going to be a relationship. They learn that whatever they need to do within the space is possible, and that they're in control of the situation. If you want to do the therapeutic powers, you can.
Okay, so the Schaefer's therapeutic powers of play. Overcoming resistance, communication, competence, creative thinking, categories, abreaction, role play, fantasy, metaphoric teaching, attachment formation, relationship enhancement, positive emotion, mastering developmental fears, and then gameplay.
The relationship enhancement part is especially important because of the safety and that it provides. If you look at the research on how counseling or any form of therapy works, you'll find that a lot of the research is pointing to the therapeutic relationship as being the main consistent factor. And so if that is your foundation and more work gets accomplished through the relationship, the therapeutic relationship, then whatever you do after establishing the relationship just adds to the benefit of therapy. But yeah, there's been a lot of research that says it's the relationship that's doing a significant amount of the work or providing the foundation for the work. And without that relationship, then you would be in a place where it would just be kind of technique after technique, or it'd be kind of disconnected.
So doll therapy, discuss that. So what is doll therapy? Doll therapy for dementia is an introduction of a baby doll to someone with dementia. And the goal of it is to improve quality of life and to improve client engagement and to kind of help with some of the challenging behaviors. And those challenging behaviors are some of the things that we discussed about the symptoms that we discussed. So there was some research done by Brandon Gasper. And so in this particular research, this team went to a long-term facility of clients with dementia. And what they did is they talked to the staff to determine which clients were displaying some of the challenging behaviors that we discussed. And what they did is they took those clients. At first, they wanted to do it based on age, but when the clients were actually entered into the study, the researchers actually didn't know the age. And so they determined that even though they said 65 and older really was not a factor. So they introduced the baby dolls to some of the clients, and some of them took to the dolls right away, some of them didn't, some of them laid the dolls down, some of them came back the next day, and then there were a couple that actually took interest in other clients' baby dolls, and then they were in turn given dolls. In the process of that, what happened was the clients, it almost gave them a purpose. So they interacted with the baby doll. They were inclined more to come out of their rooms and interact. There was also one client who actually would hide her baby doll so that other clients wouldn't take it from her. But in the process of this study, it did decrease agitation. It decreased negative behaviors, combative behaviors, and increased engagement with other residents in the facility. Clients appeared happier, and family members even reported that their loved ones smiled more and interacted with them more.
This goes back to good developmental theory and the idea that attunement and attachment is very important in building relationships or setting up development throughout the lifespan. So think about the doll play with long-term care facility patients and how that unlocks some of that attunement, attachment, some of the nurturing that they received as a child or infant, and how then that becomes the foundation for safety, how that becomes the foundation for relating to others within the facility, within family members.
So guidelines for the introduction of our baby doll. So introduce the therapeutic doll, and there are companies out there that actually sell what they have named as therapeutic dolls. Introduce the doll in a controlled environment. Use a realistic, lightweight, and soft doll. Do not force the doll on the client. So when you introduce the baby doll, you just simply want to introduce and not say, here, take it, or actually just force it on the client. And do not call the doll a doll. And do not use dolls that cry or make noises, because it may startle the client, or they may get agitated when they feel like they can't comfort. And it may produce some challenges that the caregivers are not able to address.
Yeah, I think it's important here that these be, we would do the same thing in play therapy. We would have kind of the traditional doll that doesn't make sounds, doesn't do anything specific, that would just be a doll, because the say the eyes moved or the doll made sounds that could easily trigger a startle response, especially when we're talking on someone that has lost some of their cognitive abilities, that might escalate them and produce, some combativeness or some agitation. And so basically we're starting with something that's pretty much a thing, but it's a familiar thing that we know to nurture and to care for.
Sandtray Therapy.
I can talk about Sandtray. So Sandtray is a common part of creative therapies. It's a common part of play therapy. There are very specific types of Sandtray therapy, from some of the original Sandtray therapy or sand play therapy done by Dora Koff, to Jungian versions of Sandtray. There's, if you can think of a theory within mental health, you can apply it to different forms of Sandtray. There's Adlerian, there's person-centered, there's Gestalt Sandtray. And so our theories apply well here, and how those theories apply well is basically what you're doing, or how you're prompting the individual within the Sandtray. So think about in the use of Sandtray within a patient client that has dementia. It would likely be more of the non-directive stance of Sandtray, which doesn't require the communication. It would not be so much of the directive or the types of Sandtray that have you do specific things or respond to specific prompts that the therapist may be using. So, this may be one of those things where, depending on the cognitive abilities of the individual that you're working with, you say nothing, or you keep it as simple as, show me a day in your life in the Sandtray, or show me your life. And so even if there's not a prompt there, individuals are kind of drawn to the sand, and start moving their hands around in the sand, putting objects in the sand, and it brings back those memories of playing or life as a child.
So what is Sandtray Therapy? Sandtray Therapy is a nonverbal expressive therapeutic approach that uses miniatures and sandboxes. The goal of Sandtray is to allow an expression of thoughts and feelings in a nonverbal process. And that goes back to what we were saying about not having to actually have a voice, but you're using the miniatures as a way to express your client's feelings and thoughts. And this is a picture of a Sandtray. It's basically a tray, and the inside of it is painted blue to simulate water.
And you get to do whatever you want to in it. The bigger the Sandtray, the more that can be done in it. Typically with a Sandtray comes a specific set of miniatures that you should, have at a minimum. and they represent different categories of life, from just people and things that we use in life, like vehicles and pots and pans and things like that, to things that are symbolic or mythical. They're depending on how big your Sandtray is. It could include spiritual figures. It can include images or figures that represent nature and some of the natural events of life, rainbows and clouds and things like that. So it includes things that may just be used very practical to represent parts of life, or it may be more symbolic that represent parts of life or emotions or feelings and things like that. Depending on the style of Sandtray that you're doing, your Sandtray may change. There are specific forms of Sandtray therapy that require very specific size Sandtrays. Those are not the typical type that I would use. I think that anything can be a Sandtray, from something like a Rubbermaid tote to a box like this where it's painted blue on the inside to represent water. You can also add to your Sandtray work. You can have a dry Sandtray and a wet Sandtray where one that water can be introduced into, because that adds a new level of sensory information. One of the things that we know is Sandtray is very sensory oriented, and we know that if you stimulate one sense, you typically stimulate others. If you stimulate your touch sense, you might also stimulate your visual or your auditory. And so basically awakening some of those senses would help kind of arouse the brain. I can give you an explanation for that also. Basically, the part of the brain that is stimulated by creativity is the right hemisphere of the brain. And when you stimulate the right hemisphere of the brain, it has the ability to regulate, calm down, even wake up if not very alert, the left hemisphere of the brain. So it's very much based on a lot of brain principles where you're allowing one thing that you're doing to help another part of your brain process information more. And the left hemisphere is very much involved in those analytical type things, some of the language generations, the understanding of mathematical equations, the analytical parts of our brain. Oftentimes in the dementia patient may be more affected than the creative side. So by stimulating the creative side of the brain, we also have the advantage of stimulating and giving some more power to the left hemisphere.
So we just explained how the Sandtray works, so we just covered that. But here's some basics of what you'll need, which is a rectangular tray filled with sand. And there's all different types of sand out there with different textures and things like that. The bottom of the tray is blue in color. That gives the impression of water. And then Frank discussed the miniature figurines.
There's good sand and there's bad sand. There's colored sand. There's what I would call fancy sand. There's sand made out of ground up amethyst and rubies and things like that. There's very coarse sand and there's very fine sand. So what you choose as your sand may relate to the population that you're working with. It might be better to have a more coarse sand. I can tell you that coarse sand is easier to get out of carpet than fine sand is. You'll be trying to vacuum fine sand out of carpet forever. And then Sandtrays may also, based on the situation, you may substitute rice in a Sandtray instead of sand. And that's just about preference. That's not specifically about it does something different. It's just about your preference and your location and how easy it is to clean up things. And so I've seen many Sandtrays that didn't have sand in them, they had rice in them.
And
the end.
The end.
So what questions might we have about this and applications to the gamut of dementia patients?
We had one I saw that, which we discussed, which was the difference between Alzheimer's and dementia.
Mm-hmm.
Dementia is are the symptoms, and Alzheimer's is the actual disease.
Yep.
Let's see. I plan on certifying my dog as a therapy dog for future practice. Can therapy dogs assist clients during play therapy?
They can. Animal-assisted play therapy has been around for quite some time. Probably the big name in animal-assisted play therapy is a therapist by the name of Theresa, and she is somewhere in the Northeast, but basically she's the one that writes the books on animal-assisted play therapy and has trainings and methods for how we introduce animals in the playroom, what their purpose is, and like the type of play therapy that you do, the animal, the dog or whatever animal you're introducing can have a different purpose. It can just be an animal in the room for safety and comfort, soft dog, furry cat, whatever, or it could have a specific purpose. I have seen many different individuals actually have the animals there for specific parts of the play. So it depends on what you want, but yes, they can easily be introduced into the playroom.
So they also have, I don't know if you've seen these, but they also have kind of like the therapeutic doll. They have the therapeutic animals too that are artificial as well. And there are some that actually do purr. They move parts of their body, but they're very subtle. So there's not that startling, I guess, effect. The next part of her question was, does having a therapy dog help clients with dementia, which I think we answered. Here's another question. What would occur should you see abuse in an elder during sand play when they cannot verbally tell you what is happening?
And I would say I would take this just as with a child. I would report what I'm seeing and let those that are responsible for investigate. I think about our purpose as mental health practitioners. If we suspect and have evidence of abuse, we're mandated reporters, and so we report, and that's our responsibility to do that part. But it's someone else's responsibility to do the investigation. And I know it's going to be very difficult with someone with dementia, but I once again would compare it to that with a child. There's only so much that they're going to be able to give information on a report, and so I'd be a mandated reporter, and I report what I suspected.
And in your state, there should be some 1-800 numbers for those.
Yeah. Should be. It's right.
Any more questions?
Going back to the animal-assisted, one of the other benefits of animal-assisted Sandtray play therapy, not necessarily a part of the caption area for this presentation, but where you see expressive therapy is being used a lot with those who cannot necessarily communicate, as individuals with autism that are pretty severe. And so you see the benefits of it with the nonverbal child and the dementia patient. You see that same benefit across development time, as in this awakens parts of their brain that allows them to communicate, learn skills, and it doesn't require them to have specific communication skills, because it's about practice and doing and experiencing through the creative measures things that will benefit growth and development.
Any more questions? Can we talk a little bit about play therapy a little bit? Because it even just something simple for those that are listening could be something simple as sitting down with your loved one to a puzzle. For dementia clients, they have what they call magnetic puzzles, and they're magnetic blocks basically, and they follow a pattern, and you can communicate that way and create attachment that way too. Doesn't have to be some full blown out of thousands of toys. So.
Right. It does, simple. That was one of the therapeutic powers of play, game-based play or role play. You can take, you can focus on just a therapeutic power and do a lot with a dementia patient without, like Teresa's saying, without having this full setup playroom, Sandtray room. You can have a few things that you can take into a long-term care facility, a dementia care facility, and do a lot of great work with dementia patients. I've had students at previous university that we had a practicum set up just for nursing homes and dementia care centers, and basically it was a play therapy practicum and internship, and they went in with very simple things and did a lot of great work.
And we have another question. Can Sandtray Therapy be integrated with music therapy?
Yeah, I would say think about, so if you use the word play therapy incorporates a lot of different things. It's sand, it's music, it's dance, it's all types of creativity, and
Right.
and so music and sand, it's just different forms of creativity, and it's different sensory information. So basically the more types of activities or therapeutic modalities that you can incorporate, the more likelihood that you would have of awakening specific responses and returning some functioning and then, relationships and bonding in the dementia patients. So yeah, you can easily, mix art with sand or dance with sand or music with sand. So yes.
Let's see, any more questions? Okay. I think that's it.
And if you're interested in play therapy and all of the things that it incorporates, plus the many different, if you ever went to the conference, all the many different vendors that have things you've never seen before that would be very beneficial. Think about the Association for Play Therapy and the Association for Creativity and Counseling, their conferences, their trainings, and their membership. And I know if you're a student, you can get a free membership to the Association for Play Therapy for a year, and that gets you access to a lot of different things. And so there's ways to get involved and kind of sample from the different aspects of creativity and find the place that you want or the thing that you want and to add to your practice or future practice.
Okay, I'm checking okay, there's no more questions.
Well, I guess we're done.
We are done. Thank you guys
Yeah,
for
thanks, everyone.
coming. Have a good day.
Everybody.
Thank you. Thanks.
Bye.
Bye-bye.